Hello, this is Dr. Grande. Today the question is, what is cyclothymic disorder? So cyclothymic disorder is sometimes referred to as a mild version of bipolar disorder. And with cyclothymic disorder, an individual would have numerous hypomanic symptoms and depressive symptoms in the course of 2 years. But none of those symptoms would rise to the level of a manic episode or a major depressive episode. So we can see that there are mood swings toward mania and toward depression, but they're not as great, they're not as large a movement as we see with bipolar, where you'd have mania and major depressive episodes, or bipolar 2, where you'd have hypomania and major depressive episodes. With cyclothymic disorder, these hypomanic symptoms and depressive symptoms would have to occur at least half the time over the last 2 years. And there wouldn't be a period longer than 2 months where there was no symptomology, where you didn't have any hypomanic or depressive symptoms. Now that's different in adolescents and children. It would just be 1 year for them. For adults, it's 2 years. So if someone has cyclothymic disorder and at any point they meet the diagnostic criteria for major depressive disorder or bipolar 1 disorder or bipolar 2 disorder, then the diagnosis of cyclothymic disorder is dropped. As a matter of fact, one of the criterion for cyclothymic disorder is that never in a person's history did they meet the criteria for major depressive disorder or bipolar disorder. We also have one specifier with cyclothymic disorder, and that's with anxious distress. So when we look at cyclothymic disorder, there are generally 2 ways I think that it's viewed. The first way is a mild mood disorder, like low-grade bipolar 2 disorder. So you have bipolar 1, bipolar 2, and then cyclothymic disorder sometimes is referred to as bipolar 3. Bipolar 3 is not a real mental health disorder. That's not the real term, at least not now. It's called cyclothymic disorder. But I think what they're really saying by using that term bipolar 3 is they're just pointing out that it seems to be this less severe version of bipolar 2. You could also think of it as, for many at least, depending on what research you look at, a warning that bipolar disorder may develop. Now the research indicates somewhere between 15% and 50% of individuals diagnosed with cyclothymic disorder will eventually develop bipolar disorder. So those are the 2 ways that we think of cyclothymic disorder. Cyclothymic disorder is treated in a similar fashion as we see bipolar 1 and bipolar 2 treated, although again we consider it less severe. It does still lead to clinically significant distress by definition, meaning in order to be diagnosed with cyclothymic disorder, there needs to be clinically significant distress. Also, if the symptoms are better explained by schizophrenia or schizoaffective disorder or other psychotic disorders, the diagnosis of cyclothymic disorder would not be given. The lifetime prevalence of cyclothymic disorder is thought to be under 1%, maybe approaching 1%. We're really not sure because we believe this mental health disorder is underreported. Again, the symptoms are mild compared to a lot of other similar disorders, so it makes sense that this mental health disorder would be underreported. We also believe that the risk of developing cyclothymic disorder is the same for both men and women. I hope you found this description of cyclothymic disorder to be interesting. Thanks for watching.